Hello and welcome. I'm your host, Mary Kate Eaton, Director of Education, Programs, and Operations for Providence Health System. As a reminder, the information provided during this event is for information purposes only. If you have any medical questions, please reach out to your primary care or health professional. Now let's begin. Joining me during this live event will be Colette Brown, Managing Director for Providence We Care in Portland, Oregon, Chris Cherenka, Manager Operations, Child Care Services at Providence Center for Child Development in Anchorage, Alaska, and Laura Benavente, Program Director for Early Childhood Directions at Providence St. John's Child and Family Development Center in Santa Monica, California. As part of the Providence St. Joseph Health Family of Ministries, there are 7 early childhood education centers across the states we serve. Like so many parts of our lives, the landscape of early childhood education has changed because of the COVID-19 pandemic. So Providence's Early Childhood Development Ministries serve a variety of families and children and provide many different services. Let's open with each of you telling us about your ministry, its location, who it serves, and its focus. And I'll go ahead and start with Chris.
Well, thanks, Mary Kate. Thanks for that introduction. So Providence Center for Child Development is on the campus of Providence Alaska Medical Center and serves caregivers who work in our many Providence Anchorage ministries. Its focus is childcare and early development. We have children attending who are 8 weeks old through currently, because of the pandemic and our school district isn't open, school age elementary children through 3rd grade. We are an NAYC accredited program and have been open for over 35 years.
Great, thank you so much, Chris. Colette, we'll go to you next.
Hi, so I'm Colette Brown. I'm Managing Director of Providence We Care Child Development Center. We're located in the Child Center building, which is on the campus of Prov Portland Medical Center in Portland. Our focus is early childhood development and child care. We were started in 1991 in response to the need in the area of high quality infant and toddler care. We care for children from the ages of 6 weeks up through age 5 and offer a comprehensive individualized program for children of staff of Providence facilities here in the Portland area, as well as people in the surrounding community. We follow all state improvement guidelines. We are part of a system that has tested out many programs for quality improvement.
Thank you, Colette.
Yeah.
And Laura.
Yes, hi, thanks, Mary Kate. Well, the Early Childhood Directions Program is located in the Child and Family Development Center, which is a mental health clinic for Providence St. John's in Santa Monica, California. And we serve children from 3 months up to 5 years of age. And we are also an NAYC accredited center, and we serve full-time services in childcare services to the workforce of Providence and its affiliates in the surrounding areas, as we have many medical buildings and other hospitals that are in need of childcare. And our program is very unique because we are one of the very limited centers in Santa Monica, California, that serve infant and toddler care. Our approach is a developmental approach. We are an emergent curriculum type of program where, we focus on social and emotional development in children and also supporting the family needs, especially during the crisis that we are in. Currently, we're only serving families that are essential workers at our center.
Thank you so much, all of you, for giving us a little more detail. So I'll go to Chris first. The majority of families you serve are those of a Providence caregiver at your local ministry. How have you seen families' needs change due to COVID, and how have you and the center adapted?
Well, Since March, when we really started gearing up here for the pandemic, I think the biggest changes have been, how we operate the center daily. And for instance, all children and families are screened before they come into the center, and we have static classrooms and static staff in classrooms. I think one of the biggest changes as well has been the addition of school-age children to our program, which until recently that wasn't a population that we served, but the need in March when our school district closed became apparent, and so we've been doing that. I think as well, the need to have step up our cleaning of our environments and those kinds of things, so that we're making sure that we're keeping children safe in our environments, has added another layer of for us. It's also, I think over the course of these last few months, especially here in Alaska, as our case counts have started to rise, it's become apparent that we're seeing more stress and anxiety, especially in the adults that are working with children, our families as the parents. But our children have remained fairly resilient to all of these changes. I think that we see this as something that's going to continue. And so I think as we continue to collaborate in our community with what's best practice to continue to keep our children safe in care, that's been our major focus.
Thank you, Chris. Colette, I'm wondering, how have your day-to-day operations at the center changed since early this year? And what are new challenges your ministry has overcome?
Oh my. Well, we share challenges with everybody. But in March, the governor closed all early learning facilities and childcare facilities in the state of Oregon with the opportunity to reopen as an emergency childcare facility under additional guidelines and infection control measures developed in association with the Oregon Health Authority. So we applied for and were approved as an emergency childcare facility, and we've operated without break since the beginning of the pandemic. So what changed for us is that, of course, everyone, since our facility was essentially closed by the governor, everyone had to reapply to bring their children to childcare. So we had to serve first essential workers, and then as space was available, we were allowed to enroll and keep other families as well, families who are in secondary support positions. So we have adjusted all of our classrooms as to size for stable group infection prevention, and in response to the staff that we have available to work with those children in their highly skilled areas. We have applied for and received exceptions under emergency child care from the state of Oregon for things like inside drop-off in a monitored area rather than outdoor drop-off, and for a combination of stable groups, so that combination being that all the 2-year-olds can be together, for example, in a slightly larger group than the state would allow normally. All the 1-year-olds can be together, all the infants can be together. It has enhanced the number of people that we can serve, still in an extremely safe setting, using the guidance from the hospital-based infection control, plus the guidance from the Oregon Health Authority and the Early Learning Division. We've been able to maintain a very safe atmosphere for our environment for the children.
So I know a question that we've mentioned, parents ask all the time, what a typical day looks like now, and how are you emphasizing safety while also supporting the mental well-being of the families and children of all different age groups? And I'd like to start with Laura. Maybe you could describe a typical day for your infant age.
Sure, absolutely. Well, it's the same sentiment as my colleagues have shared. Many of these restrictions and guidances are very, they're limited, and it really creates this new normal for all of us as educators, as parents ourselves, many of us. So for the infant care and the toddler care, I believe it has created a really significant impact, especially because without leaving our philosophy and our program goals and our mission of creating this nurturing environment for the children, um, social distancing for the younger children, whether it's a 3-month old, whether it's a 12-month old, it's nearly impossible. So this has been one of the most difficult aspects of all the restrictions that have been implemented into our programs. And so just to give you an idea, for example, some of the key strategies that we use in our program to do this safely and accordingly, and to meet all the regulations and to be in compliant with all the regulating agencies. Some of the key factors are smaller cohorts. For example, in our infant center, we only have 4 infants. We started with 1, and that was back in June. So now we're up to 4. The maximum that I can physically have in that classroom, particularly, it would be 5. And that's to, again, try to, keep every safety measure accounted for. Another strategy would be 2 caregivers. The ratios normally, our state ratios are 1 teacher to 4 infants. In this case, 2 caregivers is just enough to care for the amount of work and the additional work that we're having to put into practice. Adjusted hours. Normally, we would be open for 10 hours, Monday through Friday. Unfortunately, we cannot do that with the limitations that we have from all angles. So our hours for now are just about 8 hours, and this is to give enough time for our caregivers to do the setup and all during the day work, and then do the cleanup at the end of the day. This, of course, it includes all the intensified cleaning, disinfecting, and without forgetting the children, without forgetting the nurturing, the care, and the love that we always provide. But this is one of the difficulties that we have faced. But as I mentioned, it's just nearly impossible. We have to hold the children. We have to give them that sense of protection and comfort, as they're not getting it. Many of our parents are just working as essential workers, and so we try to provide the best that we can for our little ones. The modified drop-offs and pickups. Unfortunately, no parents are allowed in our center. Again, this goes totally against our philosophy and our beliefs as caregivers, that that interaction with our parents, it's not there as it was before. It's all virtual, or just a quick run of the day at pickup or drop-off. In constant communication, I would say is one of the key factors too, especially for infants and toddlers. As a day-to-day practice, it's just constant communication with our parents, whether it's via phone, email. We've come up with creative ideas in communicating with our families too, using different platforms, different apps to be able to communicate, send pictures, and summaries of the children on a daily basis. So that's in summary, that's what an infant and toddler day looks like.
Thank you, Laura. It sounds like there have been a lot of challenges to overcome, and I'm wondering how Colette, how your center has worked on that for the toddler age students.
Well, the toddlers have been operating again as a smaller group cohort, very similar to what Laura described, where a limited number of children can be in this cohort, maximum of 10 per day. We have had to be extremely careful about who we allow into this group so that we are serving the most essential workers. Again, with our new exception, we'll be able to broaden that, but we have to be extremely circumspect about infection control. Children are washing their hands a lot more than they ever thought they wanted to. They come into the school, they wash their hands, they go outdoors, they wash their hands before they go outdoors, they wash their hands when they come inside, they wash their hands before they sit down at the table, they wash their hands after they get up from the table, they're washing their hands all the time. So if we have working with a child with sensory issues, this could be a problem. So we're working with the classrooms and with the teachers and with therapists to help us make sure that the children are able to experience hand washing as a positive experience rather and more of a fun time rather than a get it done time. Also, another little thing we did to make sure that children are not spreading viruses even amongst themselves is giving them each a separate little box with their sensory toys in them. So they each have a little box with their name on it, with their container of Play-Doh, their bag of macaroni, their bag of beans or rice to play with, so that they have their own specific materials to use. And that's been really successful. I know a lot of centers are doing that. The idea is to keep the day as normal as possible, as pre-COVID as possible, while the children are having their experience at We Care, so that it's not a strange time, but it's just a little bit different. Because as we've said, we don't know how long this is going to go on, and we don't know what practices that we are going to be keeping later. So again, the stable groups of children where they know they're going to be seeing those friends every day or every week, the stable group of caregivers, so they always know who they're going to see in the classroom and they're good and trusted adults. I think one struggle that infants and toddlers started out having were face masks, that their caregivers always wearing face masks all day, and they don't have the visual cues that mouth expressions will provide. But it's been amazing to me how they've overcome this, and it really doesn't make a difference. You can make cooing noises at the babies and they will just smile at you anyway. And the toddlers are really adapting well to having limited cues. I think that's one of the things that has been most amazing to me.
It's always so impressive how resilient the children are at all ages.
Mm-hmm.
Thank you, Colette.
Mm-hmm.
And Chris, I know you mentioned that you typically wouldn't have school-age children, but your center has adapted to serve the community around you. Can you describe what a day for preschool and school-age children looks like at your center?
Well, it's very similar to what my colleagues have been describing. You know, children come into the program, they're screened, and in fact, it's interesting because now our children come in and, you know, they stand 6 feet apart from each other. They get their screening, their temperature taking, all the information, and then, you know, they go to their classrooms and it's just like a normal part of the routine now. It's not anything different for them. It doesn't throw them out of sorts or anything like that. So we have 3 large groups of preschool children. Our state, we're allowed to have 20 children in a group. So we have 3 groups of 20 preschoolers. Those groups stay static, as my colleagues were describing. They don't intermingle with each other. Pre-COVID, they would have different kinds of interactions with each other throughout the day. We always felt that important because many of our classrooms have siblings in them. So having siblings, being able to share time together is important to us and part of our philosophy. But currently, those classrooms stay static. The staff in those classrooms are static. Meaning they don't travel to other classrooms unless it's absolutely necessary, and there's a protocol for them to be able to do that. The amount of cleaning that's happening in the classroom in our state, the mandate is hourly, so we clean all the environmental high-touch surfaces on an hourly basis. Toys that children share are removed from work with the children until they're cleaned. And so that has been something, and it's funny to watch the children participate. They know that when they're done playing with something, that it goes in a clean mirror bin and that it gets cleaned before it's put out to play with again. So it's really interesting to watch how they are so resilient as well, paying so much attention to what's going on around them. And early on in the pandemic in March, our school district did close and has yet to reopen. So our caregivers have had a need for school-age care for their children, and as well as participating in all of our school district learning is on a virtual platform. So we have adapted and used some space that we had available that was in our building to bring in a group of school-age children and to be able to help parents and participate in children's learning process with the school district as well, so we can help to lessen that burden for our families. I think that was one of the things that we saw that was a real stressor, was how are they going to manage their work life and their children's school life on a school platform. So for a small group of children, we've been able to help in that process. But as well, I think too, my caregivers, the teachers in the class and staff, I think this has been something over the course of the time that has weighed on them and been stressful, and there's been lots of anxiety about, are we doing the right thing? Are we keeping all of our children as safe as we could? What are practices we need to be implementing? Are there new ones that we should be paying more attention to? And so it's been a learning process from the beginning, and I think it continues to be that.
Thank you, Chris. Laura, I know the Early Childhood Directions Program was required to close, like so many others, at the beginning of the pandemic. Can you tell us briefly about the journey to reopening and what beginning to serve families looked like?
Yes, absolutely. So our center, as many of other states, we're mandated to close. And just to remind everyone, a lot of the centers were able to operate and to serve essential workers. However, we felt the need that it was best at that time. This was mid-March when everything hit. We were all just under so much stress and uncertainties of how this was going to look like. And, we thought that, okay, maybe for 2 weeks, a month, maybe we're going to be closed and then things will go back to normal, which, this has not gone back to normal. And as Colette mentioned, this may be a very long process. So it was decided that the Early Childhood Directions Program needed to close. So we closed mid-March and we reopened June 1st. And the reopening, the time, that was a journey in itself. Because we needed to prepare for this reopening. And we didn't just take off and close the doors, but we continue actually our distance learning with all the children in the program that were still involved. And so that reopening process was a long time, and all it took was to really the time to gather all the supplies we needed. One was the PPE. At that time we were in major shortage at our ministry of PPE, and so we needed to make sure that we gather all of that necessary items for our caregivers. Also, we needed to have the supplies, not only the cleaning, disinfecting supplies, but also this new way of teaching and caring for our children, of the individualized activities, measuring the classroom literally with the measuring tape, 6 feet apart, the beds, the tables, the chairs for all the children, the cribs. So this all took time, and also for us to familiarize ourselves with the guidelines. We needed to have that level of comfort level of knowing that we're doing the right thing and that we're going to do it correctly for each group. So that itself, it took that long of a period of time just to really put everything together, put a comprehensive plan for us to be able to reopen and start talking to our parents about this reopening and how this would look like. There were many questions throughout the months from families. What is it going to look like? How are the children going to react when they can't see the teachers' faces or reactions? How is the drop off going to be like? All these questions. So myself and my team, we work endlessly just to put this together and to make it as comfortable and as easy as for the parents as it could be, just to try to lower some of those anxieties, and to remind them that, regardless, we're still here. We're the same people. We are the same caregivers that when your children left and when they're returning. So we did, and we reopened, and it was a handful of children that we reopened with, but and teachers, because the ratios, of course, we couldn't bring everyone back. So when we did it with open hands and open hearts, and I can tell you, just like the joy to have everyone back, as small as the group that we started with. It has really been a pleasure, and it all has been because of everyone's hard work. All the teachers, our dedication has been just incredible. So, that the reopening was a journey in itself, for sure.
Thank you so much for sharing that, Laura. So we've heard a lot about how you've supported families and children during this, and I'd like to hear from each of you. I'll start again with Laura, but how you're fostering a sense of community amongst your staff during this time that none of us have ever experienced before.
No, absolutely. This crisis has hit us in one way or another, whether it's personal or, someone at work. But, again, I think just as a team, we try to come together as much as possible, to build that sense of community and connection. I think these are the times where, crisis, it brings us back, and we circle back to, we are a family here at work, and we want to uphold each other as much as possible. And some days are better than others and easier than others. Just like when we feel that we got the hang of things and we have momentum and we're going with it, something could happen. Our first sickness, our staff is out. Whoa, what do we do now? Someone needs to go on a medical leave. I mean, these are all the sorts of things that are stressors in our daily lives. But we try to do as much as possible. I think that mental health support for our caregivers is so much needed right now. We are working in our program with trying to build a sense of support system for our teachers. But I think that there needs to be more work around that, because we are just, we're just going every day. And sometimes we tend to forget that we also have to take care of ourselves. I mean, we have our own families and our own children to deal with. Many of us too, with children at home doing distance learning. So I think a lot of open communication about thoughts and feelings too during our staff meetings are really important. Just being honest with one another, what's working, what's not working, how we can make this better, and just really have an open mind with everyone about the different ways that we can go about supporting each other. And our families, they bring a sense of community too all the time. I know more than ever, they're so appreciative of the work that we do with their children every day. And that is something that it really it lifts our spirit on a daily basis, or even if sometimes it's just a thank you. It could be a treat, it could be anything that it's brought to the teachers, and it really creates that wow, we're doing this is why we're doing what we do, because we are here for the parents and the children and for each other.
I love that support for the mental health of families and staff, and the message of hope that I'm hearing from all three of you. Just real quickly before we wrap, I know there were a few fun things from Colette and Chris's area for keeping things fun for the kids outside of the center for the holiday season. So do you want to touch really briefly on that?
Yeah, I could. So, right, we're coming up on the holiday of Halloween, and one of the things that we're doing is, we're sort of going all out in the program because we know that it's probably going to be the only place where the children get that sense of normalcy for the holiday. So we're having decorations, everything is decorated, and Spirit Week, and the children are dressing up every single day. And on today, we're going to be having individual static classroom, parties and dress up. And so we want, and I think our families really appreciate that because they're, they want that little bit of sense of something normal going on. So doing it in the safest way we can, or everything is being done, separately, so that every child gets a separate little treats and everything. So, I think being able to provide that for not only our families, but the staff as well, they kind of feel like they're doing something involving, doing something that's not COVID related, right? In a COVID related way. So that's, every day as a group, we are, as Laura said, a family of caregivers as well, and so we want to be able to do things in ways that bring joy as well, and that I think helps with the stress and anxiety.
Thank you so much. I know we're at time, and I hate to end the conversation, but I just love being able to hear about the message of resilience of the families, children, and staff, and willingness to adapt and solve challenges, and the focus on healthiness within the center, and keeping the families and caregivers healthy too. So a huge thank you to Colette, Chris, and Laura for joining us today, and for everyone in our childcare centers, both within the Providence family and everywhere. We are so thankful to you, and the work you're doing is truly essential. And thank you to everyone for listening and sending in your questions. To learn more about our initiative, programs, and services, ways to give, or if you're looking for help or medical advice, please visit providence.org. And make sure to follow us on social media at Providence on Twitter and at Providence Health System on LinkedIn, Facebook, and Instagram. So thank you again so much, Chris, Colette, and Laura.
It was a pleasure.
Thank you.